This is the bone of the arm that extends from the shoulder in this region to the elbow in this region. What we're going to study is the features that you guys have to know. Before we do that, you have to actually be able to know which humerus it is. It is the right or the left. And in this case here, it's shown that it's the right. And how you can know that is by figuring out or focusing on the head of the humerus, where it's pointing to, and the medial epicondyle. In this case, I know that this is the right humerus, is because the alignment of those two on this case is towards this direction. And how I know that it's the right is because the olecranon fossa is always on the back. So this tells you that this is the right humerus. So here, just know always looking at this head and the medial epicondyle with the olecranon fossa, where it's located, and you will know which humerus it is. Just spend some time discussing and learning about it, looking at so many pictures to know exactly how you can figure this out. Okay, that's the first step of studying this part of the upper limb. Okay, so now let's discuss the details of the humerus that you guys have to know for your answer. So when you begin talking about the humerus, you always mention the head. The head of the humerus is what you see right here. The anatomical neck is what you see just between the head and the greater tubercle. And in this case, when you answer for Suriski, you just have to name them. You don't need to know all those details, because that's what I experienced and it was fine for him. And then you have two things to know about. You have a surgical neck, which lies between the upper end and the shaft. I think this is the position of it. Let me see if it's labeled over here. Yes, so here, that's where the surgical neck is, right there. So anatomical neck is this part, surgical neck is this part. Okay, that's the anatomical neck, surgical neck, the head of humerus, all done. Next, you have the lesser tuberosity and the greater tuberosity. And in this diagram, you can see that the greater tuberosity is found here, and the lesser tuberosity is found more medially. The greater tuberosity is found more laterally. Okay. Next to that, we have the intertubercular sulcus. It lies between the two tuberosities, and as you can see, this is the part between the two tuberosities. And I think there's a tendon of the biceps muscle that lies within this, and you will get to study about it in the future. So that's the upper part mostly of the humerus. Okay. Next, we're going to discuss the lower end of the humerus, and anteriorly, not anteriorly, actually, inferiorly, there's the trochlea, there's the capitulum, and there's the medial epicondyle that lies closer to your thorax, and the lateral epicondyle points outwards towards the opposite side of where your body is. Okay. The capitulum and the trochlea, they help for articulation with the radius and the ulna. For example, the trochlea articulates with the trochlear notch of the ulna. Capitulum articulates with the concave superior end of the radius. So these two, you have to know exactly which one articulates with what bone of the forearm. Okay? And on top of these, you have to also know what exists. So above the trochlea, there's the coronoid fossa. And above the capitulum, there's the radial fossa. And now when we look at the posterior end, here, you can see the olecranon fossa. It's called the olecranon because and I'll show you later, the olecranon process of the ulna fits in here when the arm is extended. Okay, then you have to know the epicondyles. And as I said, medial epicondyle, lateral epicondyle. And these are mostly the features of the distal end of the humerus. And all of those details have to be known, where they're situated in relation to each other, because it's very important. Next, we're going to discuss the shaft of the humerus. The shaft of the humerus, and you have to know that it has 3 borders and 3 surfaces. Sometimes Sirski will be very specific about how those borders and surfaces are aligned. You have to spend enough time studying them, and if you don't buy this guide, YouTube is always a good source. Okay, so it has an anterior border, medial border, a lateral border. It has an anteromedial surface, anterolateral surface, and a posterior surface. Okay, this is the humerus. Moving on to the radius and the ulna. First, the radius. It is the bone lying on the side of the thumb, right here. Okay, so to discuss the details of the radius, starting from the most proximal end, it has a head, neck, tuberosity. The shaft contains the borders, 3 borders and 3 surfaces, just like the humerus. It also has an ulnar notch for the articulation with the ulna, forming the radio-ulnar joint. And then you have a styloid process for the radius. Okay, so those are the details of the radius, and we're just going to mention them and go over them really quickly in specific details here. So the head is this part, and what goes around the head is the annular ligament. So when you study this in the lab with Sirski, you'll see that this head has an edge, a very wide edge, and this is where exactly the annular ligament attaches to it. Then comes the neck. It's just below the head. Okay, not going to say anything about it. Then the radial tuberosity. Okay. Why is it important? It's because it receives the insertion of the biceps tendon. Okay, so why is this important? Is because in the future when you study the muscles, you'll have to know exactly where the insertions and the origins of the muscles are. That's the radius proximal part, the lower end of the radius. What we're going to say here is that it has a styloid process. It has an ulnar notch, and this ulnar notch articulates with the ulna, forming the distal radio-ulnar joint. Okay, and the styloid process, you'll find it on this end, right here. Imagine my hand is like that. Okay, so that's where you find the styloid process. Next, what we're going to discuss is the inferior surface of the radius. It is very important to know because the radius is the main important part to form the wrist joint, this part. The radius is the main contributor towards this joint. It articulates with 2 carpal bones of the carpal bones, so scaphoid and lunate, okay, on the inferior surface, and that's why the radius is concave from the inferior part. The medial surface, as I said, has an ulnar notch that articulates with the ulna. Okay, the shaft of the radius, as I said, it has 3 surfaces and 3 borders. And remember, it's very unique for the radius and the ulna, the interosseous border, and you will find this border as well in the lower limb between the fibula and the tibia. So the interosseous border, it has the anterior border, posterior border, and then the surfaces are the anterior surface, posterior surface, and lateral surface. These details that I'm mentioning are all important and have to be said in your answer. Next is the ulna. The ulna, it is quite different from the radius. This is the superior part of the ulna. It has an olecranon process, a coronoid process, and a trochlear notch between those 2 processes. So if you look at the lateral aspect of the ulna, you'll see that the olecranon process is found here, and This is what inserts into the olecranon fossa and the posterior aspect of the distal aspect of the humerus when the arm is extended. The coronoid process is what enters the coronoid fossa that I have mentioned over here. Just a quick reminder on the humerus. Right here, coronoid process, or enters the coronoid fossa when the arm is flexed. And the radial process is where the head of the radius inserts when the arm is flexed. Next, the trochlear notch is used for articulation with the trochlea of the humerus, as I mentioned here. Trochlea. Okay, right here. Right, and then important, remember the surfaces and borders and the distal end. In details very quickly. Olecranon process, coronoid process, trochlear notch, radial notch for the formation of the proximal radio-ulnar joint. And as I mentioned, the proximal and distal radial-ulnar joints are used for the movements of the supination and pronation. Just here. And if you don't know from those images what these are, it's this movement. When you do this, that's pronation and supination, and the joints, proximal and distal radio-ulnar joints are used for that. Okay? The radial notch, as I said, for the articulation with the ulna, and the ulnar tuberosity. So these are the main details for the ulna. Now the most distal part, the head of the ulna. Here between the ulna and the carpal bones, there's an articular disc, because those bones do not match when it comes to their shape. So that's why the articular disc is present. And also there's a styloid process here, this end, styloid process. Okay. Now the shaft, remember, interosseous border, anterior border, posterior border, anterior surface, medial surface, and the posterior surface. The interosseous border is for the attachment of the interosseous joint between the radius and ulna. These are just fibers passing between the interosseous borders of both radius and ulna. All right, next, let's talk about the carpal bones. Carpal bones and the skeleton of the hand. Here, the hand is basically shown to you like that, and I'm just going to put my hand near it. Boom. Okay, that's how the hand is shown. And this point right here, if you've always wondered what this bone is, it's called the pisiform. This bone that is arised right here, this like a protuberance, this is called the pisiform bone. Okay, pisiform bone, and the carpal bones are situated here. Okay, so let's go and talk about what's present, and you have to study those carpal bones, and you have to know them by name and where they're located and how they're situated. So my hand is here: scaphoid, lunate, triquetrum, pisiform. Okay. Then you have articulating with the metatarsal one, going toward the thumb is the trapezium. Then trapezoid, then capitate, and then hamate. Okay, these are the carpal bones, and you will find them really important to study when you're studying about the carpal tunnel. And I can make a separate video about the carpal tunnel. Okay, so again, scaphoid, lunate, triquetrum, pisiform, trapezium that articulates with the thumb, trapezoid, capitate, and hamate. Okay, now we go back. We have metacarpal bones. 1, 2, 3, 4, 5. 5 is closest to the fusiform bone. That's 5. 1 is on the thumb. That's labia heel here. Now we said the 3 parts of the phalanges: proximal, middle, and distal. And each one has this except for the thumb. It's just proximal and distal without the middle. Okay? If you know and say this details of it, you have stated the skeleton of the upper limb. And as I said, this book also has quite a bit of details about metacarpal bones and phalanges. If you have one to read, you can go further and read it. But what I've mentioned in this video so far can cover the skeleton of the upper limb. Okay? Thank you guys for tuning in for this video, and I hope I have been helpful. And as I said, if you want to buy this guide, you can always reach out to us.